By reversing the normal relationship at the shoulder and placing the ball on the socket side, the muscles of the shoulder are pulled back out to an optimal length, helping restore range of motion. Surgical skill and results vary considerably among surgeons. As with any surgical procedure, the reverse total shoulder can have significant complications. It's important to have a detailed and thorough evaluation by a shoulder specialist to determine the best treatment option for you personally.